At present, I wanted to start by an opening statement that I'm going to read, and then we'll dive into the meeting. Good morning. Thank you to each participant and commissioner for your willingness to interrupt this morning's schedule and make the necessary arrangements to accommodate this specially called commission meeting. The need became increasingly evident as the week ended, and continuing escalation in COVID cases and hospitalizations have risen to an alarming level. I will begin this meeting with an overview of its purpose and provide some background on the scope and what we hope to accomplish. Today's meeting is designed to raise awareness of the critical COVID concerns rising in our local healthcare system at present. We will discuss those realities and various options to consider, which can support the healthcare system and reverse the local trends. There's no resolution to pass at this meeting, but we could determine we wish to do so at a subsequent meeting once it has been written and noticed. As you know, we can no longer meet virtually and vote due to Florida statutes, but this allows us to begin discussions on what can be considered. Furthermore, I know I speak for our entire commission when I state that our goal is to keep responsible businesses open and thriving as we reduce the level of community positivity. This was done very successfully last July following the citywide mask mandate. On Saturday, Lakeland Regional Health issued a statement. Our infectious disease experts urge you to have no unmasked gathering outside of your immediate family. Let's review a little bit of recent history to consider what has happened to get us where we are. A holiday surge was anticipated and it was discussed at our December 21st commission meeting. We expected more citizens traveling and less precautions observed among friends and family during the holiday visit would predictably weaken the safeguards that had been attained at work or school. That surge happened, but it was not resulting in an upward blip followed by a stabilizing reduction. Instead, it continues to rise. We have now experienced 14 consecutive days of over 10% positivity, and this meeting also maintains our commitment to address what additional precautions can now be considered. Before we begin today's discussion, I request that all of us throughout the community take a deep breath and open a renewed mind for discussion on where we are now regarding COVID-19 here in mid-January 2021. This is my encouragement today. Rather than becoming immediately defensive about what we may personally believe is unnecessary, let's focus on what our healthcare experts believe is necessary and seek a way to support those recommendations. In life, we must correct difficult problems. The way to do so, and one method to eradicate them as quickly and effectively as possible, is to be as drastic as necessary. This is a moment we need to do just that. Lives are at stake, and the accountability we all share, not just as community leaders, but as community citizens, requires our most insightful cooperation and compassion. This is not a time to focus on our restrictions, but rather to focus on others' restoration. So at the end of our December commission meeting, Commissioner Selvich raised the need to discuss what we can be doing more aggressively to decrease the COVID positivity, hospitalizations, and deaths. As the governor has eliminated the ability to enforce individual mask mandate fines and compliance locally, I responded urging Polk County to consider a mask mandate applicable and enforceable for businesses, as Hillsborough and Pinellas counties have done, and which is currently enforced. I'm reporting this morning there does not appear to be any current interest in adopting such a resolution by the Polk County Commission. Then, early last week, Commissioner Selvich approached Lakeland City Attorney Palmer Davis, suggesting the Commission could discuss at least 4 options as a minimum in either a policy workshop or a commission setting. Those options include, number 1, ordering a mask mandate for the next 100 days. Option 2, take the Hillsborough County approach, send a request to the County Commission recommending action at the county level. Option 3, adopt a 100-day mask challenge, publish a City Commission resolution, and begin a City Lakeland communications campaign. And option 4, take no action. Whereas we hoped to see the numbers begin to subside this past week, and that really wasn't my hope. Instead, they increased. So today we will discuss Commissioner Selvich's 4 options, as well as consider others you may suggest as a commission. However, before we do so, let's first listen to our healthcare experts. It is their goal to have us hear the local status through their eyes and advise us on how we can provide the greatest addressable, corrective impact possible. After they have done so, we will then begin our consideration of next necessary steps that parallel existing needs while avoiding any effort to polarize ourselves against solutions. So we'll have our medical experts with us in this order, provided everyone is present. So I see Dr. Joy Jackson will be first, then Danielle Drummond, and then Dr. Steve Ackinger. And after that, have addressed that, Commissioner Selvich, those 4 options will be considered. And then for the commission, I have just distributed through Assistant City Attorney, the City Manager Cologne, a document that considers 3 additional options and some others that we may note and discuss. So with that, as a prelude, Dr. Jackson, can you be up? And we need to see you both on camera if you can be, and if not, we'll just take your voice.
Mayor Mutz, this is Kevin. Dr. Jackson was having computer issues and had to reboot her machine. So if we could take possibly Dr. Ackinger at a turn and then bring Dr. Jackson on when she's able to do so, that would be great.
All right. Go ahead, sir. And good morning.
Good morning. Okay, good morning. Good morning. Thank you, Commission, for the invitation and for the willingness to hear from us on the front lines in the fight against COVID-19 during this difficult time. What we are going through is, I think, was predicted months ago by the CDC, which would be the increase in case numbers that would accompany the holiday season. That we've clearly seen an increase in disease activity locally. I don't want to belabor the point. I'm sure Dr. Jackson and Danielle maybe will give more specific statistics, but there's no question that we are seeing an increasing number of people contract COVID-19, and we're also seeing a lot of sick patients with the disease. From the local perspective of the Watson Clinic, I just want to encourage everyone to take our community's responsibility to protect each other, because I think in the field of medicine we just want to care for those who are in need, care for the vulnerable, and I think that public health is not only going to protect all of us, but should also be directed at protecting the vulnerable, those who can't necessarily speak for themselves, who aren't able to understand what's going on around them. So we really do have a community moral imperative, in my view, to take this seriously and to do what we can to slow down the spread of COVID-19 and to continue the fight ongoing. From a clinic's perspective, we're seeing a substantially increased demand for our urgent care services, something that we have really picked up in activity in the last couple of months. So we are experiencing waiting times which are significantly higher than we've ever experienced. We are starting to feeling the strain of inability or difficulty in finding healthcare staff. We have had obviously physicians, staff members who have gotten COVID-19 themselves, and all of this just puts further strain on the ability to provide effective health care. So we're really buckling in certain areas. There's no question about it. It's been difficult finding staff, since the entire country seems to be going through the same problem, it's a little different than what we experienced in July. In July, we were able to bring in healthcare providers from other parts of the country. But right now, it's very difficult to fill, and we are having difficulty filling key positions, and that is something that's new. And if we continue to go down the pathway that we're going, I'm fearful that we'll just have to be unable to provide services simply due to the lack of people. So that's a major concern of mine. Second would be the amount of we got to keep in mind that other illnesses are continuing right now. Cancer, kidney disease, all of these types of illnesses, heart disease, vascular disease, these are all continuing, and our ability to care for those patients is definitely compromised by the volume of COVID-19 that we are seeing. So right now, we're in a danger inflection point, in my view, to be able to continue to provide the care that the community deserves and that the community really expects from the healthcare providers. So I do believe that the fundamentals of COVID-19 control are mask distancing, social distancing, and hand hygiene. We really have to do all three of these, especially during these critical times. And whatever we can do to encourage the use in the community, if a mandate is required to do that, perhaps I realize the political difficulties of mandating mask wearing, but it does set an example. I do think it does set an example for people when they see other people doing it and they realize the seriousness of what we're going through. There are a lot of people who do feel will cooperate and wish and want to pitch in, but I think that they need that little bit of an impetus that their leaders feel this is important and feel this is serious. So I would encourage anything we can do to get public use of masks, but also that the public understands that it's in-house gatherings that are also a problem, and there is no way to mandate change there, obviously. So really we do need public buy-in to understand that even though you may have a completely asymptomatic disease, you're just contributing to spreading it through the community. So when we look at those numbers, if we see a number of cases per day, you can use that to sort of figure, the higher that number is, the higher the number of people who are able of spreading the disease at the current moment in time. So the more cases in Polk County means more people are able to spread the illness, and that just increases the risk of everybody in the entire community. So the importance of showing restraint on in-home gatherings in restaurants, these are the ways that the virus really thrives. And that's going to be maybe a little more difficult as the temperature goes down, and people in Florida especially. I hate it when it drops below 70 degrees. I mean, I grew up in Daytona Beach. What do you expect? But we have to avoid those